Welcome everyone to the South and Southeast Asia Climate and Health Responders course. It's a great pleasure to launch this important course in 2025 to the region, and we are thrilled to see such a strong interest with over 2,600 participants joining us. Before we begin, I would love to get to know you better, so please share in the chat your name, position, and country. We also will take a moment to introduce ourselves. My name is Daniele Magalhães. I'm the Senior Project Director at the Global Consortium on Climate and Health Education, the GCCHE, at Columbia University. And the GCCHE was launched in 2017, shortly after the Paris Agreement, when a coalition of 60 US academic institutions recognized the urgent need to prepare health professionals to address climate change, one of the greatest health threats of our time. Today, the consortium has grown to include over 390 academic institutions from around the world, which have pledged at the dean's level to integrate climate change into health education. Together, these institutions are training more than 250,000 students annually in climate and health. If your institutions offer education on climate change and health, we warmly invite you to join the consortium. Just follow the link in the chat. And if you are joining us as an individual, you are also welcome to join as a member. The GCCHE mission is to ensure that all health professionals throughout the world have the knowledge and skills to identify, prevent, reduce, and respond to the health impacts of climate change, thereby reducing the health disparities and improving quality of health and well-being. One of our initiatives is the Climate and Health Responders course, which we started in 2022 and has expanded across the regions, reaching around 10,000 professionals annually. Mediterranean edition is planned for 2026, so be aware. And each of these courses is regionally tailored and co-developed with local experts. To give you an idea, this course is in partnership with among 10 institutions, and we invited 31 experts from across the region who will share their knowledge, their challenges, and also their solution. This course is designed to strengthen your communication skills, enhance your ability to identify climate-related health risks, and mostly important, help you respond effectively. I would like to acknowledge the contributions of the institutions involved in the development and supporting this initiative, the WHO Shouro, the Ashoka University in India, Monash University, Indonesia, University of Management and Technology in Pakistan, University of Jaffna in Sri Lanka, University of Malaya in Malaysia, the International Center for Disease Research in Bangladesh, the Partnership for Sustainable Development in Nepal, and the Center for Chronic Disease Control in India. And here's the incredible team working behind the scenes who made this training possible: Poornima, Bishnu, Suman, Gabriela, Rajendra, Alaya, Priya, Parvez, Saroj, Victor, and Bala. And he is our GCCHE team, Cecilia Sorensen, our director, Margaret, our project manager, Tasia, our fellow, Marianne, our administrator. And I also would like to thank you, the WHO Seattle team, for their partnership and endorsement of this initiative. A special thank you to Ms. Faustina Gomez and Mr. Rasheed Hussain, who is the director of the Department of Healthier Population and Non-Communicable Diseases, and who I now invite to deliver the opening remarks. So thank you. Go ahead. Sorry.
Yeah, thank you. And good morning, good afternoon, good evening, and a very warm greetings to all joining us here today. It is a great honor to be a part of the launch of this timely and important initiative, the South and Southeast Asia Climate and Health Responders course, led by, of course, Cecilia, Sorensen, and team from Columbia University, the Global Consortium on Climate and Health Education. I would like to commend the organizers, partners, and participants who have come together across borders and sectors to address what is, without a question, one of the greatest health challenges of our time, the climate crisis. This region, our Southeast Asia region, is on the front lines, from record heat waves in India and Bangladesh to worsening floods in Thailand and Indonesia, as well as recent earthquake in Myanmar. The human toll of climate change is already being counted in hospital beds, lost livelihoods, and shortened lives. Yet behind every statistic is a story of a child developing asthma due to air pollution, a family displaced by extreme weather, or a community forced to make impossible choices in the face of drought or disease. But we are not here today to only acknowledge the challenge. We are here to build capacity, to build leadership, and to build a new generation of responders who understand the deep interconnections between climate and health and who are ready to act. This course does more than teach skills. It fosters a regional movement, one rooted in science, equity, and urgency. A movement that recognizes that the solutions to climate-driven health threats must be locally grounded and culturally relevant, while drawing strength from global knowledge and solidarity. At WHO, we have made it a priority to integrate climate resilience into health systems to protect the most vulnerable and to ensure that health remains at the center of the climate conversation. But we cannot do it alone. We need responders, we need health workers, environmental scientists, urban planners, youth advocates, and policy makers all working together as you are doing here. To the participants, you're not just learners in this course, you are leaders. The knowledge, tools, and network that you gain here will ripple outward into communities, institutions, and decision-making arenas. You are helping to define what health leadership looks like in the era of climate change. So let me close my remarks by thanking Columbia University for its vision, our partners for their commitment, and each of you for your dedication. We at WHOCRO remains committed and are happy to partner in this initiative. Together, let's turn climate concern into climate action, action that saves lives, protects the planet, and secures a healthier future for all. Thank you, and I wish a transformative and inspiring course ahead. Thank you. Over to you.
Thank you so much, Ms. Hussain. Thank you so much for all the support of WHO Seattle. And we have also a message from Dr. Cecilia Sorensen.
Hello, everyone. Good morning, good afternoon, and good evening. My name is Cecilia Sorensen, and I'm the director of the Global Consortium on Climate and Health Education based at Columbia University in New York. It is my pleasure to welcome you all to the start of the South and Southeast Asia Climate and Health Responders course. I want to start by thanking partners from throughout this region who have come together around the support program, lending their time, expertise, and networks to making this truly a world-class educational opportunity. Climate change presents a pressing health emergency for South and Southeast Asia, with already ongoing negative impacts on health and well-being. We know that health professionals, no matter their background, alongside health agencies, are vital to addressing and mitigating these health threats and building system-wide response capacity. However, in order to meet these challenges, we must grow our understanding of opportunities which may exist and the potential benefits and limitations of current adaptation, mitigation, and resilience building solutions. And our goal over the coming 11 weeks is to do just that. I want to give a huge thanks to all of you who are here today, prioritizing this challenge and working together towards solutions. We look forward to getting to know you over the next 11 weeks, and I really hope you enjoy this program. If you haven't already, I would also like to take this opportunity to personally invite you to join the Global Consortium on Climate and Health Education, also known as the GCCHE. We are a network of over 400 health professional training institutions and over 150 civil society organizations who are working together to increase the education of health professionals around the world on climate change and planetary health. Please join us as we grow our offerings and initiatives around the globe. Again, thank you for your time and thank you for making this a priority. We hope you enjoy this program.
So thank you so much, everybody, again. And now I declared this course open, and I would like to pass through my colleague, Bishnu Bhatta, who is the director of the Partnership for Sustainable Development in Nepal. Bishnu, over to you.
Yeah, thank you, Danielle. Let me share the screen first. Okay, I would like to welcome all of you. Now we have more than 2,600 participants registered, and now more than 1,300 around 1,300 joined these calls. This is our first a session we are starting from today, and this is climate change for the health professional. This is the first one, and after that, and every Wednesday we will continue our sessions. Same time and 1.5 hours every Wednesday. That one. These are the course objective we set out. We have three objectives mainly. First one is enhance the knowledge, confidence, and communication abilities and of the current and future health professionals concerning the climate crisis. That is improve the population care and public health practices, or serve as a credible advocate with the institution, communities, and professional domains, and also equip interested current health professionals with the knowledge and skills needed to educate their institutions and own learner, so that health effect of the climate change and emergency preparedness can be incorporated more easily into pre and post licensure training across the globe. And the third one is build and strengthen and as well and inform community around climate and health education, advocacy, policy for the health professionals with a strong mentorship and expert support. These are the three main core objective we define for this course. And the schedule is as I said before, we start from today, 7th May, 5:30 Indian Standard Time to the 7, 1.5 hour climate change for the health professional for the first one, degraded air quality second one, and that will be in the May 14th, heat-related illness and mortality and third one, and vector-borne diseases and climate extreme agriculture and food security and extreme weather events and disaster and climate change and mental health, building resilience and health, and health service delivery and sustainability, advancing climate justice through the climate change, communication, engagement and advocacy, climate change and health equity. These are the 11 sessions we set up every a Wednesday, 5:30 to 7. And this is a first one we are starting. And these are the a few learning objective we have set out. That is explain the general mechanism of the greenhouse effect and describe how human activities, mainly combustion of fossil fuel, are exacerbated by natural phenomena. That is the first one we have objective, distinguish between like a climate mitigation, adaptation, and resilience. That's the second one. And identify the key impact of the climate change on health in the region and some countries, and explain the main health impact of climate change, how the health sector contributes to the climate change and environmental degradation, and identify the new ways in which climate change preferentially impact socioeconomically, racially or ethnically marginalized community locally and globally, and understand that the voice of the health professionals in advocacy and policy is essential to addressing the climate and health crisis. These are like a learning objective we set out for in total 90 minutes. Within a 90 minutes, there is like a 40 minutes lectures by the expert, and and also after that we do have a Q&A sessions, and also all the like videos, recording, slides, and resources will be available on the course in the website. You can always like go and download and go through later on. And after that, we do have a case study between 15 to 20 minutes. Some session has a one case study, some session has a two case studies, and that is like that one. After that, both presentation we do have a Q&A, and all the attendance is automatically recorded during the like live Zoom sessions. So individual attendance is only counted. That if you use like jointly, then only one count there. So you have to use your own Zoom link to count and to get the certificate for your attendance. And your attendance is not like counted if you join with the colleagues links, and YouTube view also will not count towards the attendance. You can learn from the YouTube and you can get the information, but will not count your like attendance if you go through the YouTube channel. And also we have a like a plan to distribute a certificate, and to get a certificate you have to attend at least 7 out of 7 live Zoom sessions, and there will be final exams with a score of the 70% you have to obtain. And if you are able to get like at least 70%, then you will get a like certificate. There's a two like things. One is you have to at least participate 7 out of 11 Zoom sessions, and you have to pass the get the 70% of the marks in the exam. And the certificate of the participant is only available for people who has the same email address, register all Zoom session and exam. And final exam must be completed using the same email address used to attend the Zoom sessions. And the exam links will be sent on the final day of the class via email and WhatsApp, and we will close on Sunday. And the format is 25. There will be 25 multiple choice questions, true and false questions, and you have to answer those one, and you have to get at least 70% marks. Participants should be prepared to take the exam in one sitting. Now you cannot start and hold and do again. You have to finish your exam in one sittings. Now we do have two presenters now. One like Alexis from Dr. Poornima Prabhakaran, and other one Dr. Shouro Dasgupta. Shouro Dasgupta will do the a case study at the end, and now Dr. Poornima Prabhakaran, she will be presenting giving the lecture for the 20 minutes in these topics, today's topics. And let me talk about Dr. Poornima. She's a trained physician from the Bangalore University, and she also has a master's degree in epidemiology and from London School of Hygiene and tropical medicines. Also, she has a PhD degree from in the social medicines from University of Bristol. She has a long working experience in different fields and different hospitals and different colleges. And she was the head of environmental health and director of the Center for Environmental Health at the Public Health Foundation of India. Also, she was the chair of the research subcommittee of WHO working group for the climate change and health. Also, member of the board director of the Global Climate and Health Alliances. Now she is a director in the Ashoka University Center for Health Analytical Research and Training and Biosciences, Ashoka University in India. She's a senior research scientist, Center for Chronic Disease Control, New Delhi. Also, currently, she is also like a Lancet Commissioner for Sustainable Healthcare and is member of the technical group. She also chair an expert on air pollution and climate change, the World Health World Health Federation. And so I think this is like a small introduction for the Dr. like Poornima, and I think like it's the time for the Dr. Poornima. It's time to you for the 40 minutes for your relaxation.
Yeah, thank you, Dr. Bhatta, for the kind introduction. Let me just share my slides here. Are you able to see my slides?
Yes.
Yeah, thank you. So good evening to all the participants from South and Southeast Asia, and good morning and good afternoon to others joining us from other parts of the world. It's my pleasure and privilege to be delivering the opening lecture of this very important and timely course. Keeping in mind that the participant profile today includes young students who are wanting to learn about climate change and health, but also seasoned professionals working in this domain for some time, this opening session will seek to provide you an overview of climate and health principles, a brief dive into health impacts and role of the health sector. We will be following up this in coming weeks with a deep dive into each of the sessions, as Dr. Bhatta already told us. So climate change is not a new phenomenon. But personally, for me, I feel that 2015, the year when the historic Paris Agreement was signed and countries around the world committed to taking action for reducing the impacts of climate change, was really the inflection point that brought the climate and health conversation to audiences across geographies at all times in recent years. The media did its bit as well, and it's no news nowadays to see these kind of visuals being brought to us front and center in news and media around the world. This was in 2015 when the New York Times featured stark reality from the ground in geographies.
Sorry, the slide is not moving.
Yeah, I just moved it now. So the crux of the problem is that the global surface temperature is increasing. And we have evidence now from around the world. These are graphics from the Intergovernmental Panel on Climate Change, which has shown us that compared to the last 1,000 years, the current century is really the time when the greenhouse gas emissions causing climate change have started to increase exponentially. The figure on the left actually...
Poornima, your slides are not advancing.
This is I have moved the slide.
Yeah, on our screen, it doesn't appear to be. It's still on the first slide.
Oh, I'm not sure why that's it. Should I stop share and try again?
Yeah, maybe that's best.
Sorry.
Yes, there you go.
Okay. So I'm not sure if this slide came up earlier, but this is just to show how media has also done its bit to bring visuals on changing climate from around the world to us, different audiences and across time in recent years. The crux of the problem is that the global surface temperature is increasing, and the Intergovernmental Panel on Climate Change has shown us through its work that compared to the last 1,000 years, the current century is really the time when exponential increase in temperature has happened. And what you see here on the left side is different scenarios. The one at the bottom is holding the activities constant. But if we continue living life and business as usual, there's going to be only an increase in the surface temperatures. The figure on the left, on the right, actually here also shows you the warming world in the decades to come, 2020 to 29 in this first panel, and 2090 to 2099 in the next panel. So we need to understand why this is happening. On the x-axis of this graphic, you will see the years, and on the y-axis is the temperature. The panel at the bottom here in the beige band here is actually reflecting changes in land use over time. And we can see that aligning with the Industrial Revolution in the early 90s, that there is a steady increase in the emissions due to changes in land use. The pink band here is due to the combustion of fossil fuels, and this is also steadily increasing around the same time. Paralleling these changes is the change in carbon dioxide concentrations, which is also starting to rise around this time and increasing at an exponential rate, along with a change in temperature. The spikes here show some dynamical variations, but definitely paralleling carbon emissions and change in carbon dioxide concentrations around the world, temperatures are also increasing. I want to draw your attention to the concept of greenhouse effect here. Solar radiation powers this whole climate system. So this radiation from the sun reaches the earth, and a good amount of it is actually reflected back. But half of the solar radiation is absorbed by the earth's surface and results in warming of the ground temperature. This results in the formation of infrared radiation, which also is reflected back through the atmosphere. But a good proportion of this infrared radiation is trapped by gases in the lower layers of the atmosphere just above the Earth. And this trapping of heat in these lower layers of the atmosphere actually causes global warming. And this is what we refer to as the greenhouse effect. So what are these gases that are causing the greenhouse gas effect? The greenhouse gases are actually certain molecules in the lower layers of the atmosphere that have the ability to accumulate and trap heat in the lower layers. Primarily among these greenhouse gas emissions are carbon dioxide, which constitutes about 2/3 of the greenhouse gas proportions, and is the most potent of the greenhouse gases, remaining in the atmosphere for nearly 1,000 years because it's constantly moving in and out of the air through carbon cycle. Methane, which constitutes about 10% of the greenhouse gas emissions, also comes from industrial activity, but largely from fermentation in landfills, but also enteric fermentation in livestock. Nitrous oxide and fluorinated gases are the other greenhouse gas emissions that are responsible for trapping the infrared radiation and causing the greenhouse gas effect. The graphic here on the right actually shows you with time, especially in the last 2 decades, that the proportions of these greenhouse gas emissions worldwide are steadily increasing, with carbon dioxide, as you see here, forming the biggest proportion of the greenhouse gases. So what is the relation between greenhouse gases and global warming? The greenhouse gases like carbon dioxide and methane do occur naturally and are play an important role in the Earth's climate. If they didn't exist, we would be in probably a much colder planet. However, human activities, which includes mining, burning of fossil fuels like coal, oil, and natural gas for energy and transportation, and the rapid growth of industry and land use degradation emits a lot of carbon dioxide and other greenhouse gases. And this accumulation of greenhouse gases from human activity or anthropogenic causes are really, together with the natural causes, resulting in an overall warming of the planet. What are the likely impacts of this accumulation of greenhouse gases in the lower layers causing this rise in global surface temperature? Potential impacts are rising temperatures, warming of our water bodies, and the ocean warming leads to a rise in sea level, in addition to melting of the glaciers that causes all the changes in sea level rise, but also changes in precipitation patterns. The impacts are wide-ranging. We could have impacts across sectors, including health, agriculture, forest, our water resources, coastal areas, as well as our biodiversity. Many of you working in this space will be familiar with this graphic, but it's an interesting one that shows you in a snapshot what the impacts of climate change are on human health. Increasing carbon dioxide levels lead to rising temperatures, extreme weather events, including floods, droughts, deteriorating air quality, particularly from the combustion of fossil fuels, and ocean warming leading to rising sea levels. What you see on the outer side here is the range of impacts that occur as a result of these events. This could be changes in vector ecology, deteriorating air quality, impacts on water supply and our food supply, extreme heat exacerbating illnesses, degraded living conditions, and exacerbated social inequities. And most importantly, impacts on health and health systems. Environmental degradation that results from all of this actually has led to forced migration, civil conflict, loss of jobs and livelihoods. Why are we, especially in South and Southeast Asia, talking about climate change? It's been widely stated now that climate change is the biggest public health challenge of the 21st century. We see it all in our region. We are seeing floods, we are seeing droughts, we are seeing poor air quality, wildfires, glacial melts leading to sea level rise. But all of this also reminds us of the fact that this is not all gloom and doom. Climate change is also touted to be the biggest public health opportunity of the 21st century. And I hope over the course of this lecture, I can make you understand why. I want to start with this graphic. It's one of my favorite figures. It's from the Lancet in 2009. The top half of this graphic is actually a heat map, which shows you from where the legacy carbon emissions have come. It's really from the countries that rapidly developed in the last few centuries before. This is what we call the global north, from where the greenhouse gas emissions largely came. But I want to call your attention to the lower half of this graphic, which depicts the health consequences of this legacy greenhouse gas emissions. And if you look at it, it is the countries in the South and Southeast Asia region. You've got it all over here, and the Africas, which actually feel the brunt of disease burden from climate change. And this is an important reason, in fact, the most important imperative for us to take action to protect the health of our populations. Globally, climate challenges public health are, the statistics are that between 2030 and 2050, we will face approximately 250,000 additional deaths from malnutrition, malaria, diarrhea, and heat stress, with the cost to the health in terms of direct damages being somewhere between USD 2 to 4 billion per year by 2030. Countries in our region that already are facing climate disasters see over 60,000 deaths sometimes in a year. And where we have weaker health infrastructure is where we're going to struggle to face up to these challenges. A World Bank report that talked about South Asia's heat hotspots put the cost for a country like India in terms of social and economic costs at US $86 for every additional ton of carbon dioxide emission, ahead of countries like US and Saudi Arabia, which will face half the economic cost. The implications of climate change for India, therefore, cannot be understated. And I'm sure the situation, if it was costed, is similar for other countries in Southeast Asia. I want to stop to take a reality check over here, why it is imperative for us to take action. This is a statistic from a UNICEF report from 2023, which stated that by 2050, virtually every child on Earth, and Earth is home to over 2 billion children, is forecast to face more frequent heat waves, regardless of whether the world achieves a low greenhouse gas emission scenario. The statement that this is the coldest year of the rest of our children's lives should make us sit up and take notice that this is an urgent crisis. The climate crisis is a health crisis that has compounding impacts for the people in our region, particularly our children. Calling your attention to changes in precipitation patterns, which are also likely to become more extreme, and again, regions in our part of the world are actually going to face the worst impact. The warming of oceans has led to about 3.4 millimeters rise in sea levels in recent years. It really means that people in South and Southeast Asia are living a new climate normal. We face disastrous floods, we have deteriorating air quality, we are facing droughts, we are facing floods, and it's going to disrupt life and livelihoods for the people in our countries. People have started to take notice. I have noticed that the World Bank has taken action to develop a South Asia roadmap for 2021 to 2025. And this report has put out the statistics to say that almost 750 million people in 8 countries in our region have been affected by one or more climate disasters in the last 2 decades alone. Changing climate can sharply diminish living conditions for up to 800 million people in our region. And this is no mean figure. It means that there's going to be a whopping impact on health and health systems in this region. Again, South Asia has been a leader in pioneering many climate smart solutions, and these include innovative community approaches to coastal resilience, adopting and scaling up transitions to renewable energy, as well as regenerative forestry, among others. But accelerating any of these initiatives is going to be critical to building resilience. It requires political will, it requires financing. And most importantly, I think we need to understand that this is not a one-size-fits-all approach. Even within the South and Southeast Asia region, our countries face different vulnerabilities. And I'll just give you a snapshot of some of those. India as a country is a hub for heat waves. We also have the dubious distinction of being a home to 15 out of 20 most polluted cities in the world. Apart from warmer days, we are also facing warmer nights, and this can have impact on our work lives and economic productivity. Floods, whether it's the Mumbai or Kerala floods in India, floods in Jakarta or Sumatra in Indonesia, we are seeing disruption in the activities of daily living annually from devastating rainfall and floods. Red Cross and Red Crescent societies have called the South Asian floods one of the worst regional humanitarian crises in recent years. Bangladesh in our region is the most flood prone with a long coastline. It's vulnerable to heavy rainfalls, but also glacial melts. And annually, the floods have affected all segments of population in this country with severe downstream effects on health, livelihoods, and economy. Tracking the cyclone paths in this country over the last 50 years has shown this country has remained among the highest risk countries for annual floods. And the reasons are many. Contributors to flooding in Bangladesh area include the snowmelt, deforestation, flooding from rivers and opening of dams, as well as the cyclones. Nepal, which is also housed in our region, ranks 4th globally in terms of climate vulnerability. It experiences rising temperatures like the rest of our countries, extreme precipitation patterns, but also because of its location and its terrain, it's vulnerable to landslides and glacial lake outburst floods, which has far-reaching consequences in its lower plains, again impacting its agriculture, biodiversity, and healthcare access for its people. Southeast Asia region is also home to Maldives, which is a small island developing state. And this country has historically not really contributed to the greenhouse gas emissions, probably only in recent years, as compared to countries like the United States, China, or even India. Its low-lying geography makes it amongst the most vulnerable. It's threatened by rising sea levels, coastal erosion, and extreme weather events. But this is going to threaten its habitats as well as livelihoods. And it's a country that's dependent on its fisheries and tourism. And it's threatening to get submerged because of changing climate patterns. There's going to be ocean warming and acidification in this region, coral reef degradation, and diminishing fish stocks. Drawing your attention to some more statistics in this region, I want to bring attention to water insecurity. Again, this is data from the UN World Water Development Report. And this part of the world is subject to imminent physical water scarcity, but also the remaining water bodies are often polluted, making it a health concern for many of the populations in this region. Talking about our renewable water resources as well, if we use a statistic called the water-stressed country, India, for example, is a water-stressed country which has less than 1,700 cubic meters of water, fresh water, per person per year. And other countries in this region also fall in the same bracket. Again, a cause for concern, given this is an important resource which is rapidly depleting. Coming to food security, again, this is from the World Food Programme and draws attention to the climate change impacts on food insecurity. Many of the countries in our region depend on agriculture, and changing climate patterns, especially increasing temperature, is going to affect global food production. And therefore, food insecurity is going to become a major concern in our countries. Growing evidence is also showing us that the rapid increase in temperature is also affecting crop maturation patterns, which means that the nutrient content of our crops is also going to change. So both food insecurity as well as nutrient insecurity is going to be a growing concern for this part of the world. There's a new term that has been coined by a publication in The Lancet in 2019 called the global syndemic. And this is an important concept for us to remember. It speaks to the concept of countries in this part of the world being vulnerable to one end of the malnutrition spectrum, which is undernutrition, but also because of the impacts of climate change on global food production, we're probably going to push our populations to accessing processed foods, thereby pushing themselves to the other end of the malnutrition spectrum, overweight and obesity. So the three pandemics of climate change, undernutrition and overnutrition fueling each other has been named as the global syndemic. And this is an important concept for us to address and understand. Like I said before, countries in our region depend a lot on agriculture. A country like Bangladesh, for example, has 20% of its GDP coming from agriculture and about 50% of people employed in agriculture. India, too, is largely an agroeconomy. So severe drought can lead to food insecurity, but also affect our livelihoods and economy. And here is another statistic that I would like to show you from the World Bank, which shows us clearly that compared to the rest of the world, South Asia has a good proportion of its GDP coming from agriculture, anywhere from 5 to 30%, and employs a good proportion of its population in this sector. So climate change has a lot of indirect consequences for not just direct livelihoods of food, but also for national economies in this region. Switching gears a little bit, I want to talk to you a little bit about who faces the greatest impacts. Climate change really impacts all segments of the population, but in all of our countries, we have these vulnerable groups that are going to be disproportionately affected. And these vulnerable groups include children, women, people who are already sick, elderly, as well as marginalized populations that are already subject to social inclusion. So any climate responsive action plans must take into account these vulnerable groups. Our countries particularly have densely populated coastal regions. We have communities dependent on monsoon-fed agriculture, and climate shocks are going to exacerbate existing inequities for these vulnerable groups. So I think it's important when we start to address climate change and impacts that we focus on these vulnerable groups because for them, there's worsening propensity for inequities that already exist in terms of access to healthcare, as well as economic security, especially for the women. Here is another resource that I want to share with you, which is focusing on another vulnerable group. This is children in South Asia. This is from the UNICEF, and there is an interesting interactive dashboard that UNICEF produced. And this talks about children's climate risk index. And again, At least 4 countries in South and Southeast Asia, which includes Afghanistan, Pakistan, Bangladesh, and India, have children that are most vulnerable in terms of this index, most vulnerable in terms of the climate and environmental shocks, but also ranking highest amongst the world in terms of climate vulnerability. This is a very, very concerning statistic because children are really our future demographic dividend. These visuals really tell the story. Impacts on women, on children, affecting activities of daily living, but also really disrupting access to food, to housing, to education, and most importantly, displacement of these populations as a result of acute climate events. And I want to bring to you this statistic on climate refugees. Again, this part of the world, South and Southeast Asia, having one of the highest propensity for people having to get displaced and compounding poverty in this region. We have over 1 million people who could be displaced as a result of the acute climate events. So what do we need to do as climate and health responders? We need to adapt. We need to become resilient. We need to mitigate the the greenhouse gas emissions responsible for climate change. But we also need to build awareness, look for financing to do all of this, but also hope that there will be political will. And I think this is a nice point in the course, in the lecture, where I will bring to you 3 important concepts in addressing climate and health. The first of this is adaptation. Climate adaptation refers to the process of adjustment to both actual as well as expected climate and its effects, in order to moderate harm, but also to exploit the beneficial opportunities that we may have. This helps to manage risks of current as well as future climate change impacts. Climate mitigation refers to processes or interventions that we can take to reduce the causes of climate change by reducing primarily the greenhouse gas emissions. This includes creating sinks for greenhouse gases, but also channels for removal of the greenhouse gases. Lastly, the term climate resilience, which you will hear repeatedly, refers to the capacity of social, economic, and environmental systems to cope with climate-related hazards, the trends and disturbances caused by acute climate events, and responding and reorganizing in ways that maintain our essential functioning and identity and structure, but also keeping room for adaptation and transformation. I think these are important keywords that people working in climate and health need to remember. My last part of this lecture will shift to health systems, and I want to draw your attention to what links climate change to healthcare delivery. We've spoken about the increasing recognition of the impacts of climate change on health. So there's going to be growing dependence on our healthcare services. We need to be aware, we need to have requisite knowledge about the climate-sensitive illnesses, the growing burden that is going to happen with a changing climate, but we also need the infrastructure to handle this growing burden of diseases. Question is, are we prepared? So this is really a wake-up call to all of us. We as climate and health responders really need to take urgent action to respond to this crisis, because the climate crisis is really a health crisis. It strikes at the very core of the people's health, but also our health systems. While health systems have a core mission to keep people healthy, we're often faced by situations like this. This is from the Chennai floods in India in December 2015, where people had to be moved from a healthcare center. This is not different from situations in other parts of the world. This is also playing out in other continents. This is as a result of wildfires in California. So climate really is an equalizer, but we need to take response that is contextualized and responsive to our own situations. One fact that I wanted to remind you about is that while we deliver healthcare, we have a very noble mission to take care of the health of our populations. But while other sectors are contributing to the greenhouse gas emissions, does the health sector also have a role? And do we need to care? And I want to remind you that health sector, even while we deliver healthcare services, is also contributing to greenhouse gases. and that has been measured to be nearly 5% of the global greenhouse gas emissions. So this is a little bit of a paradox, because we do take the Hippocratic oath as healthcare professionals that we do no harm, but paradoxically, the health sector, by virtue of its service delivery, also contributes to the greenhouse gas emissions. So while the world committed to responding to climate change in 2015 when the Paris Agreement was signed, there was a simultaneous call to the health sector also to mobilize ourselves to become climate leaders. This is an important call, and what we need to do to start really is to build climate resilient and low carbon health systems, because we are the first responders. When there are acute climate events, it is the health sector that needs to be available. It needs to be the last building standing, but also the last building functioning to be able to deliver uninterrupted care. We therefore need to build robust infrastructure. We need to be aware of the climate-related disease burden in whatever situation, whether it's the aftermath of floods, droughts, heat waves, air pollution, the growing burden of vector-borne diseases, but also post-traumatic disorders, which are leading to growing climate-related mental health. Simultaneously, we also need to think about how we can reduce our own climate footprint. I've already said the health sector contributes nearly 4.4%, about 5% of the global greenhouse gas emissions. And just to give you a perspective, it is equivalent to emissions from about 500 coal-fired power plants. So the health sector has two roles. We need to adapt and become resilient. And this is the WHO definition of climate resilient health system. Every term here is important. A climate resilient health system is one that is capable of anticipating, responding to, coping with, recovering from, and adapting to climate-related shocks and stress, so that we can bring sustained improvements in population health despite an unstable climate. We also need to think about mitigation, healthcare, including hospitals, health systems, and our supply chain, which actually is responsible for a big proportion of the emissions in the health sector, needs to become a sustainable low carbon system, and we need to work towards mitigating our climate footprint. So reminding you again about climate change being the biggest global health threat of the 21st century, we learned what is climate change. We learned what it means for health. But what has been done and what still needs to be done is something that we need to keep reminding ourselves as first responders to this crisis. And I will just use this figure again from the WHO to give you a snapshot of what climate change does in terms of impacts on health as well as health systems. And what we really need to do as climate responders is need to rise to this challenge as first responders by making ourselves aware of everything that you see in this graphic. What are our vulnerabilities with respect to our geography? What are the climate-related hazards? What are the different exposures that we are vulnerable to, but also the range of health outcomes as a result of acute climate events, and what impacts does climate have on health systems and facilities. As people working in public health, we also have a job to do in terms of building a repository of homegrown research and evidence to feed programs and policies in our region. We have enough evidence to show that climate change impacts health, but we need homegrown evidence. So every country in this region really needs to also play its role in building a contextualized evidence base that can then be used to build policies and programs in our region. There's international awareness that is happening at the global level. The World Health Assembly has called for action to address climate change. Most recently, last World Health Assembly, May 2024, there was a resolution on climate and health. We have a lot of national adaptation plans of action, but countries in the Southeast Asia region are yet to develop our health national adaptation plans. We have 11 countries in the CRO region. Not all of us have health national adaptation plans. And I want to bring this quote from the IPCC to say that we have a rapidly closing window of opportunity to secure a livable and sustainable future for all. So it's really time now for action. We have a lot of clear direction from global agencies like the UNFCCC, which is the UN Framework for Climate Change, which says that we need to take action to secure human health and welfare. I already mentioned the World Health Assembly, but it's our role now to take action for our region in awareness raising, building partnerships for purpose, growing the evidence base, but also strengthening our health systems. There's also a groundswell. There's a public voice that's also now recognizing that the climate crisis is upon us. It's literally in our backyards. And this is a UNDP global scan, which actually talked to people on the ground on what they thought about global warming and the greenhouse effect. And no surprises here. One of the most important concerns was the human health impacts of climate change. And I'll close here by saying that we have a role. Sorry. We have a role here to play as health advocates because the voice of the health professional is really the one that is the most respected. And I think there's a global momentum for health professionals to take action. And I think this is an example of health-centric dialogues being brought to the global climate conferences. And this is what happened in the COP 2021 at Glasgow, when 40 million professionals from around the world signed and endorsed a healthy climate prescription letter, which was presented to the COP leadership and countries around the world committed to taking climate action. The WHO has taken leadership in forming an alliance for transformative action in climate and health. And I think we now regularly have health conversations and health professionals present in a conference which was previously only represented by delegations from environment ministries. We had the first health day at the last COP in COP28 in Dubai, and a health declaration in a subsequent COP last year in Baku. I think it's time that we all recognize our responsibilities, and I want to close with one example from a leading public health leader from India. This is a quote from Professor Srinath Reddy, who's a cardiologist and public health leader in India, who said back in 2018 in a conference on climate change and health in San Francisco that never before in human history have we been so forewarned of a doomed destiny, but never before in human history have we been so forearmed with the knowledge and the tools to alter the course of that destiny. This is just a reminder to say that we know the problem. It's time to act. Thank you so much for your attention, and I hope I've not overstepped my time, Dr. Bhatta. Thank you.
Yes, yeah, thank you, Dr. Poornima. Because you have taken like 37 minutes, so you had like exactly the time. Now, like I like to introduce our next presenter. He's here now, and he's like a Dr. Shouro Dasgupta, and he will be like presenting like a case study for like 15 to 20 minutes, mostly like a 15 minutes essay. And let me like introduce himself. Dr. Shouro Dasgupta, originally he's from Bangladesh, and his research primarily concentrated on the effect of the labor force, food security, health, and inequality. Particularly, he's interested in the effect of the households and the efficacy of the social protection policy in the next context of the climate change. And also, he leads the IEMPI labor impact sectors. Recently led the health risk evaluation for the first European Union climate risk assessment. And also, he's the author of the Global Europe and Latin America and Lancet Come Down on the climate change and health. He's like one of the 78 expert convened by UNFCCC to assist the UN UAE to Berlin program to develop the indicators for measuring progress towards like global goal and adaptation. And now I think like Dr. Dasgupta, you can start your like a case history right now. You have like a 15 minutes. Thank you.
Excuse me. Thank you, Professor, for the kind introduction, and it's great to be here. I join you today from Potsdam, where we are deciding on the next set of scenarios that we'll study or that will include in the IPCC AR7 assessment. And I'll jump right into it. So my lecture today is sort of divided into three parts. One, I'll give you an overview of climate change and occupational health, impact on the labor force. Then I'll show some global results, which have been showcased and highlighted in IPCC reports previously. And then we'll look at a case study from the UK, but you will notice that it is very relevant for many other countries as well. So the labor force, why is that something that something needs to be studied? I think the motivation is important. Labor accounts for a substantial share of total value added in the economy. In many countries, even in high-income countries, labor force or labor damages make up most of the damages due to climate change. In countries such as Bangladesh and large parts of the developing world, as much as 50% damages come through the labor force, right? We know that both climate and labor shocks have been linked to negative impacts. But as Professor Poornima has so aptly mentioned, we do need more evidence. We need more evidence for the field of climate litigation. We need more evidence to showcase the costs of not mitigating and the global benefits of investing in mitigation activities, and especially how these benefits or the co-benefits are reflected for countries such as Bangladesh and India, right? So if we start with the premise that heat stress is already having adverse effects on the labor force, then we can engage with policymakers and decision makers for adequate or feasible adaptation and especially adaptation policies for the labor force, but also showcase to the rest of the world the benefits of mitigating. What our results or our latest research shows or quantifies is the extent to which changes in labor can be attributed to climate change. We can do this at the global level, but as you will see that we have a regional focus so that we can really pick out what is going to happen or what has happened to regions such as Southeast Asia. And of course, we provide impacts for the future as well to understand what the costs of not doing anything or the cost of inaction. So this is from a paper that we published this November. It is the first comprehensive review on heat stress impacts on occupational health. This was published in Nature Reviews and Art and Environment. I led the paper with a group of authors who work, among other things, impacts on the labor force. So we can start from the WHO diagram that Dr. Poornima showed. Heat hazard increases vulnerability, which we can measure through gender, age, physical health of workers, whether someone has a disability, mental health conditions, and of course their diet. Exposure is mediated by outdoor activities. Of course, we know that people who work outside, such as agriculture and construction workers, are more affected. The type of equipment a worker has to use, environmental conditions that they work in. It is generally accepted that around beyond 37 degrees, heat stress on occupational health amplifies, right? And then if we boil down occupational health-related impacts, we can look into time off work, reduced cognitive functions, risk of accidents or occupational injuries, tiredness induced by heat stress, impaired judgment due to the conditions being unfavorable, reduced coordination, mental health impacts, and then of course we have the general health impacts to deal with, sunburn, heat rash, heat cramps, heat exhaustion, weakness, fast breathing or heartbeat, feeling of sickness. And then ultimately, in the worst case scenario, heat stress can induce heat stroke, right? And this could result in confusion, slurred speech, loss of consciousness, seizures, and of course, dehydration. So factors influencing heat stress risk and the corresponding general health and occupational health impacts are something we have known for a while, right? But it is important that they're highlighted so that we understand what these impacts are. Heat stress, in summary, affects the health of workers through physiological and behavioral responses, which in turn affects the labor force outcomes that that economists like myself love to measure, such as labor supply, which is number of hours of work, labor productivity, which is the effort a worker can put in during the number of hours they're working in, and of course, labor capacity, which is sort of a physiological assessment of workers under different environmental conditions. So in this diagram, I've tried to give an overview how heat hazards or heat stress affects occupational health, and of course, the vulnerabilities that amplifies this health risks and the exposures that affect these health risks as well. Some evidence from the literature in the US, a paper published nearly 11 years ago, the authors found that beyond about 29 to 32 degrees, the risk of workplace injuries increases by 5 to 7%. And this is, of course, compared to temperatures around 16 degrees. However, when temperature exceeds 38 or 37.7 or 38 degrees, the risk of injuries at workplace increases by between 10 to 15%, right? Extreme heat, as we have just seen, affects workers through multiple physiological mechanisms. And the reported ones include diminished concentration, mental fatigue, dehydration, exhaustion, which all can amplify the risk of occupational injuries and occupational mortality. Recently, surveys undertaken by us and by other groups have shown that high heat stress at work results in workers reporting increasing heart, respiratory, and kidney diseases, potentially leading to heat stroke, exhaustion, as the body cannot maintain its normal temperature. One particular research that is being undertaken is right now is the impact of heat stress on kidney diseases among female workers. This is especially important for countries in Southeast Asia, where female outdoor workers often intentionally dehydrate themselves because they know they may not have access to a toilet. And this is a societal issue then, which is being amplified by climate change. Physically demanding work further compounds these risks by generating additional internal body heat. Climate change, of course, affects outdoor workers comparatively more than indoor workers. In indoors, you can have cooling systems. Urban heat island effects intensifies both daytime and nighttime temperatures. The case study you will see, workers from the UK reported that high nighttime temperatures often affect their daily work more than high daytime temperatures. This is because high nighttime temperature results in lack of sleep or people having bad sleep, right? Heat-related fatigue significantly impacts workers' alertness to job hazards, which increases the chances of risk and injury. If I feel there are questions, but I can't see them right now. I'll come to them in a bit. So this map is from our paper that I showed at the beginning of the lecture. The ILO estimates that out of a total global workforce of 3.4 billion workers, 2.4 billion workers experience excessive heat at work. This leads to around 23 million occupational injuries per year and about 19,000 deaths. In my conversations with the ILO, we have come to the conclusion that this is very much an underestimate. The actual numbers are much higher. And that becomes clearer when you look at this map. This map, we created this map using not just official reports, but also we looked through newspaper reports in several languages. And as you can see, it is very clear that this is an underreporting. If you look at the Gulf countries, they report a high number of deaths, which is 10,000 workers per year. But this is during the times when several thousand workers died constructing the beautiful stadiums for the Qatar World Cup, which we all enjoyed. Only one out of those 6,000 workers postmortem reports mentioned heat stress. That's the level of underreporting we're dealing with. If you look at the numbers from the USA, between 2011 and 2021, in 10 years, there were 436 deaths reported at work. In Mexico, this was about 100. France reported 4 in 2020, 12 in 2022. India, between 1983 and 1998, reported 800 occupational deaths. In 2019, we only found mentions of 3 mortalities. In 2022, however, 25 heat-related mortality incidences were reported in Maharashtra alone. And then you can see numbers from Pakistan. In 2022, we had 62 reported deaths. So, does someone have a question? Okay. Maybe you can ask later. So I'll move on.
Yes.
Do you have a question? Go on.
No, move on. We'll do the question later.
Okay, thank you. Yeah. So I've already shown that. So this is from our latest research that is under review in Nature Climate Change. What we find is that effective labor, that is total impact on the labor force, is 3.1 percentage points lower during 1998 and 2018 compared to what would happen without climate change, right? So this number might seem small, but this is at the global average level. If we look at the regions, these numbers are much higher. Even in high exposure sectors, we have as high as 9.7 percentage point decline in Western Africa, and more than 5 percentage point decline in Southeastern Asia, more than 8 percentage point decline in Middle Africa. And these are not just impacts on the labor force. We can translate these damages on the economy as a whole. And as you can see, that due to climate change impacts on the labor force, in 2018 alone, Southeastern Asia's GDP per capita impacts were about 19%, right? So we would have been substantially richer without climate change already. These are the effects. Southeast Asia remains or is currently one of the, if not the most vulnerable regions due to climate change. Now moving to the UK, this is our case study. Last July, which was when the UK did not have a heat wave, we collected primary data on 2,000 UK workers, right? Just after a period of high heat stress. Basically, the data was collected in the first week of August, and we asked workers about their experiences during the last 2 weeks of July. So as you can see, the map of the UK is getting redder and redder. Throughout July, the temperature has increased every single day, basically. More than 2,000 workers. The data reflects the UK Labour Force Survey. This is the only known source of data on adaptation and adaptive capacity in the workforce globally. This is the first time such data was collected. We found out that 3/4 of the workers worked in an area where temperature anomaly was 0.5 degree above the long-term average. Nearly more than 8% workers were working in locations where temperature anomaly was greater than 1 degree. So actual climate change was a degree higher than what it needs to be. Nearly 50% of the sample, even in the UK, worked in conditions without air conditioning, right? Nearly just under a third respondents felt that the recent high heat days affected their health. 29% worked day shifts, 40% worked during the evening, and so on. Coming to health effects identified predominantly symptoms of heat stroke or heat stress, such as headaches and dizziness. Workers themselves took a variety of adaptation measures to deal with health. by changing, by working earlier or later, or by finishing earlier or later. They were forced to work fewer hours due to high heat stress. 13% workers took more rest breaks to protect their health. Nearly one-third reported drinking more water or other fluids more often to protect their body, protect their health from heat stress. Some people were empowered to change where they worked, but most people did not have that luxury. And this is even more so in countries such as India and Bangladesh, where most workers cannot choose when to work, right? Yeah, I don't have a lot of time, I understand, but I'm also coming up to finish. Almost a fifth of those employed said their employer had implemented some changes to their workplace, such as installing air conditioning, increasing ventilation, or providing greater access to hydration. But again, only 20% of employers took actions. The rest did not do anything to reduce suffering of the workers, right? Nearly half of the respondents reported receiving some kind of advance warning. This is again something we do not have in Southeast Asia, advanced early warning or advanced or early warning of heat stress or high heat events. 24% received alerts from their employers, 40% from Met Office, which is UK's National Weather Services. Nearly 34% from media such as the BBC. So this again goes to show the power of public institutions such as BBC, which are institutions such as this are increasingly under stress in the US, where workers will suffer even more. In the context of health, we found that high heat days substantially affected workers' health. Female workers suffered more compared to men. Workers with existing health conditions suffered more. Workers who were not empowered to adapt, so those who could not change their working location, or they could not change which shifts to work on, they suffered more. Workers without regular contracts suffered more, such as those doing food delivery or those on zero-hour type contracts. They suffered exponentially more damages. So we find clear and robust evidence that reductions in labor outcomes due to heat stress can be attributed to climate change, right? Regions such as ours, Southeast Asia, is one of the most vulnerable and at risk due to climate change. And this is not just in the context of health, as Dr. Poornima said, but also in the context of labor force and the economy as a whole. So this is a starting point only, right, to contribute to the estimation of loss and damage, to provide evidence for climate litigation. As an academic, the next battles will not be in the top 5 journals. It will be in the court of law. We have to take our scientific evidence to juries and judges and convince them that they must force authorities to take more actions. They must put punitive actions on polluters. This is the only way we're going to be able to deal with climate change. And of course, the effects show intra-regional inequalities can increase as exposure to heat stress depends on the type of labor, especially those working in sectors such as agriculture and construction, where income is also generally lower. As such, these impacts can lead to poverty traps and has shown to lead to poverty traps, which has substantial inequality and distributional implications. With that, I thank you for your attention.
Yeah, thank you for presentation. It is like just over the 19 minutes. So we do have a very little time for the Q&A. So yeah, we do have a lot of questions here. And because there's several questions we have, but I don't think we can able to answer all these questions. I just maybe go through a few of them. Maybe this is for the Dr. Poornima. Maybe adaptation and resilience seems a bit similar. Would be great to hear more on what are the key differences. That is from one of Shashwat from Nepal. That's the one question. There is one is what would be the beneficial opportunity of climate adaptation be? That is another one that is from like a Srutika Ranwal from other country. I'm just like a randomly like a selecting few questions and that is one is like how is like a concentrated program that create by behavioral change effectively to a community, especially in developing countries that lack resources in all aspects. What parameters could be public health professional use in order to assess if goals are met? I think this is like a 3-4 questions just asked. Maybe you can answer this one, maybe, and then I can ask like a Dasgupta a few questions.
Okay, thank you everyone for all the attention to this opening session. I think in terms of, I think this comes up often, like, the differences between adaptation and resilience. There is a little bit of an overlap for sure, but I think when we talk about adaptation, it is more about making adjustments in terms of responding to any of these acute climate events. So, for example, if there is an impending heat wave, for example, maybe the thing would be that you change the times that you go out, and you could change working hours, for example. Those are more in terms of changes at individual and kind of program level. In terms of resilience, it's more about larger infrastructural changes, may I put it that way. Like, you maintain your structure and infrastructure and functioning even in the face of these climate impacts. So it's more about your infrastructure resilience as well as functional resilience. But I think adaptation is more about changes in actions and stuff. I mean, it's a broad difference, but I could share more, in the chat, recognizing that there is not much time. But Dr. Bhatta, the other two questions kind of seemed like overlap as well. So do you want me to pick a particular one?
Maybe I think we do have just like a 4 minutes or so, maybe.
Type it maybe while Dr. Shouro takes the other question.
One more question. How can we integrate climate data with the health in low-income countries in the absence of advanced technology?
Yeah, I mean, that's another one that we struggle with always. I think, first of all, I think data itself is a problem, and we face it in all contexts, that oftentimes data is collected. It may not be collected in the way that we want it. It may not be complete. It may not be in the formats that we can use to do research. But I think increasingly we are becoming cognizant of the fact that we need to have probably surveillance systems. And when we talk data, it also depends on what data. Are we talking health data? We're talking exposure data. So health data, of course, it needs to be collected in a certain way. And it's important to collect it at all levels, at level of healthcare, but also at the government level. There are programs and policies which could set up surveillance systems to collect health data. And we're doing it in countries like in India. We do it for heat-related illnesses. We're doing it for air pollution-related illnesses. But how to integrate it, I think the technology and innovations should come from shared knowledge and practices. And I think that's why we have these partnerships for purpose that I like to call, where we can collaborate and work to address these issues. I hope I've addressed that.
Yeah, thank you. Because of the time constraint, I think we don't have enough time to like answer all the questions. But like we have all the questions recorded here, and our presenter will answer those questions, and we'll put that one in our like a system there, so that you can get those questions. I just picked like few questions for the Dasgupta. There is a few one is there any studies where climate change has affected healthcare workers' efficacy? That is one, and the other one is productivity. Is there any labor loss of the labor productivity because of the climate change related causes? I think I'll ask these two questions, and then maybe we can close it down.
Yeah, that's a very important question. So on specific healthcare workers, I remember maybe just one from Latin America. I'll try to find it and then share with everyone. But that is obviously a big gap in the literature right now, looking into impacts on healthcare workers. But on the labor productivity as a whole, on workers' impacts, there has been several studies. This is a This is a ever-expanding literature. I'm just going to put one of mine where we look at global impacts in the chat for everyone to sorry, hosts and panelists, here we go, so everyone can look into. So we have plenty of evidence that climate change, especially heat stress, does affect worker productivity, especially in high exposure sectors such as agriculture and construction. And of course, where workers have to use PPP, let's say, specific type of clothing and equipment, which often increases their body heat. So we do have evidence from that, yes.
Yeah, one more question, because we
Yeah.
are focused South and Southeast Asia, then most of the people from South Asia, they go to the work in the Gulf countries. The question is those being affected in Gulf are always be migrated from other countries. Is this due to the work safety or just health issues after climate change?
Combination of both. We all know that migrant workers, unfortunately, in the Middle East have fewer protection compared to the native workers there. As a result, climate change or heat stress affects these workers or migrant workers more because they have fewer adaptation strategies at hand. They're less empowered. They cannot take a break even if they want to. And many of the migrant workers, if not most of the migrant workers, work outside in agriculture and construction. So they're more exposed. As a result, they're more vulnerable to climate change.
Okay, thank you. I think we just past the time limits, 90 minutes is it is a 7 IST standard time, Indian Standard Time, and I have just share my last slide. Please join the WhatsApp group for update and information for the course planning team, and you can scan that one and show that all the relevant information maybe. This is a PowerPoint presentation, a case study, other reading material, other things. You can always scan it and this WhatsApp group and join here, and you will get all the updated information in your WhatsApp. Again, I would like to thank you, all of you, and joining for today. This is a first day and first course. Maybe we have some lacks, and maybe we could not start on time or overlap or this and that. But from next week, we start exactly the same time, 5:30 in the evening. It goes for the 90 minutes, and I hope from next time our number will be increased. There is around 1,300 participated in this course, and I would like to thank each of you. Please continue, join all the way to the another next 10 round of our courses. And good morning or good evening or good night for all of you. Thank you for joining the session, and I'd like to conclude this session now. Thank you.
Thank you.
Thank you.
Well done.
Thank you, Dr. Bhatta. I was worried.
Yeah, thank you.
Well done.
Thank you.
Okay. Take care. Bye.
Bye.
Bye. Bye.
Very well spoken, Dr. Poornima. Very nice. Your lecture.